All right, happy Mother's Day this weekend, right? And so this is a special topic we want to talk about in terms of moms out there. We get this question all the time in terms of, hey, what can I do about my breasts, right? In terms of thoughts.
Yeah, so as far as a mommy makeover, a lot happens throughout pregnancy and after, potentially breastfeeding, that type of thing. Things don't look the same as they once did, maybe. So there's a couple different options for moms wanting to improve the look of their breasts after children. Let's talk about when is the right time.
Yeah, and Meredith, as a new mom, right, like you totally get this right now and be like, okay, well, what are the phases and stages this is going to go through? Are they going to go back to where they were? Are they going to stay big? Are they going to, what's going to happen, right? And that, it really depends on physiology to say, hey, are they going to stay bigger now? Has the skin stretched? Is it going to shrink back in? What's going to change? And what's the ultimate outcome of where should they be versus where do I want them to be, right? So I think your first question was a great one to say, when do we start thinking about these things? Because all these changes are happening and you don't know if they're going to stop happening or what. And it comes down to when is that whole phase and that change in the body done? And so one of the key things is like, when do periods start again, right? And that gives you a little idea of like hormones are balancing themselves out, because some of these hormone changes are the ones that cause the elasticity to change, right? And the skin structure and that part of it. Well, that's one topic that we want to talk about, right? Second one is breastfeeding. If you breastfed, when's the right time after to do anything about this? And then, third topic is, are you planning to have more kids?
Right. So we would want to be completely done having kids, and then how long afterwards would you say?
Right, and so I think it really depends on if you're committed to that next kid or not, or what you're planning on doing. But ultimately, you want to wait till you're done having both kids, because it's going to grow and shrink, and things are going to change for that part. Now, the first question that you have to ask is, all right, if we breastfed, we want to wait till at least 6 months after breastfeeding is done, because the ducts are still large, there's still some glandular tissue, all that stuff's still in there, it's producing things, and it's changing, right? So with all those different changes, I think you want to wait that part out, make sure the hormones, balance themselves back out, get to regular periods, and then talk about where are we at, where do we want to be.
Definitely. So as far as options, we talked about the different changes, the skin stretching, the elasticity of the skin, the volume growth and then loss of that volume. What are our options? Let's talk first about a breast lift.
Yeah, so breast lift, right? I think even pull back a little bit and say, hey, do I want to be bigger or smaller than I am, right? Like a simple basic question to say, do I want to be bigger or smaller? Because a breast lift makes you a little bit smaller. We got to take away something to lift the actual nipple position and the breast position up higher. So when we take away that tissue, whether it's just skin, it's still going to be a little bit smaller. So I think answering that first question is super important to say bigger or smaller, and then you can figure out how big or how small you want them to be, and then if the nipple position needs to change with it. If that makes sense.
Yeah, so you said it gets a little bit smaller if you're going to lift. You're taking out skin, mostly skin, right? Maybe a little bit of tissue.
Yeah, mostly skin, a little bit of tissue to contour and shape, right? Mm-hmm. The biggest difference between a lift and a reduction is the actual amount of tissue we take out. A reduction, we're taking out a lot more tissue because we're trying to decrease the size and also move the nipple position higher. With a lift, we're doing the same thing, but we're just not taking out as much tissue.
Mm-hmm. So then back to do I want to be bigger or smaller? What are my options for that? Obviously, implants.
Right, implants is one of the most common ways that we talk about it. In the last 5 to 10 years, you've seen fat grafting being an option, right? Taking fat from other places, putting it into the breast, making them bigger in terms of the size or the upper pole, or giving a different shape, right? Bringing them closer together just by using fat. So there are all these different techniques, not using your own tissue, that you don't have to use implants to change the shape and volume of the breast.
And how does that last compared to implants?
Well, the good thing is the fat's your own, right? And that's a good and bad thing. In terms of the fat, in terms of grafting, about 70 to 80% of it stays. So you want to over-graft as much of the fat that you can in terms of getting the ideal shape and size that you want. And then since it's yours, it changes with you, right? You gain weight, you're going to get bigger. You lose weight, you're going to get smaller, right? It all adjusts to your body. Our bodies are crazy organisms,
Right, definitely. And as far as the shape, you said you can kind of shape it and make it perky with your own fat. How does that compare to implants?
Yeah, and so in terms of being perky, right? So fat kind of it's malleable, it's moldable, it's like clay, right? So it's gonna go where it's gonna go. And so a lot of times if you don't have the structure, a lot of moms, the structure got stretched out with the engorgement of the breast, making the breast milk in that part. Well, if that gets stretched out, when we put the fat in, it's gonna go to the bottom, right? It's not gonna give the more rounded, perkier look. It's gonna give a more natural look. And usually you're going up about a cup size or so. You can't go up too big in it because there's not enough tissue to actually put these little parts of fat into place and give you the structure that you want to have.
And how much fat would you have to be able to go up, say, a cup size or so?
Yeah, so a cup size is about 100 cc's or so, but if you want to have the 100 cc's stay, you got to overgraft it to like 150 cc's or so to try to get that one cup size bigger. So, but that's per side also, so it's a total of 300 cc's or so that I'm going to take out from someone.
So I need to have some fat somewhere for this to come.
Yeah, you're really not a candidate.
All right, awesome. And then as far as recovery, chasing kids around, what does the ideal recovery period look like?
Yeah, I think recovery is a great question. It depends on which surgery that you have done, like what recovery looks like. An implant's a little bit different, and an implant above the muscle versus below the muscle is also a little bit different. If it goes below the muscle, we're actually cutting the muscle across. We're putting the implant in there to get that slope at the top of the breast. Versus if you go above the muscle, you're getting more of a rounded upper pole full kind of breast shape, and that recovery can be pretty quick. But both for the breast augmentation, I think recovery for that is maybe about 3 or 4 days or so. No heavy lifting for 6 weeks like anything else. In terms of a lift and a reduction, those things are pretty similar too. It's just the volume of tissue, the more that we're taking out. Recovery is pretty quick with that. It's like 2 or 3 days, people are feeling pretty good. And they can resume most of their normal activity other than working out, no heavy lifting. We don't want any of the sutures or anything like that to pop, and we want everything to heal. So again, it's pretty straightforward. People recover, especially moms, recover from these surgeries exceptionally well. And even the combination of doing a lift and putting an implant, because the things have gotten droopy or anything like that, that also can be done together at the same time. Recovery for that is also the same amount of time in terms of 6 weeks, no heavy lifting, no swimming, none of that stuff. But you can start pretty much doing most of the things you do in your life within 4 or 5 days.
Awesome, sounds great. And what happens if, say, I think I'm done having kids, and then, things happen. I have another kid, I want to breastfeed, whatever.
Yep, the surprise,
The
right?
surprise.
And so in terms of the surprise kid, you can totally breastfeed afterwards. I don't think there's anything that limits you from doing it. Now, in terms of reduction, sometimes we're taking out some tissue, so you might have a lower amount of volume for that production, but a tendency for women that have had breast reductions is that their tissue grows back pretty regularly because they're sensitive to the hormones. And so for those patients, it's gonna be there in terms of growing back for that tissue.
Awesome, great. Do we have any questions?
Yes, we do. Our first question is, can I still breastfeed after getting implants?
Yeah, I think we're covering some of that right now in terms of the breastfeeding part. Implants above or below the muscle, it doesn't affect breastfeeding. You still have the glands, the ducts, everything that's needed to actually breastfeed. So it shouldn't limit your ability to breastfeed.
Awesome. Somebody was wondering, after they do a breast lift, where the scars will be and how visible they are.
So this really depends on how much we have to move the nipple and areola, right? And so you will really want to look in the mirror and say, halfway between the shoulder and the elbow is where the nipple is supposed to be. Well, if you know what that distance is, that tells us how much skin we're going to have to remove and redrain. So sometimes it can be a lollipop, or it can be just a circle where it's a circle that we shrink in to be matching the nipple and the areola, or it's a lollipop that comes down, or it's an anchor scar that goes on in the crease, up and then around the nipple and areola. It really just depends on how much tissue we're having to take out to get you to the size and how far we're moving things.
Awesome. Elizabeth wants to know, what is the biggest size implants you've ever done?
Ooh, biggest size implants. Salient implants for sure. I think we've done like 1,500 cc's in terms of these implants. It just, it would multiple sets of implants, skin and stretch, and yet still wanting to be fairly large in terms of chest width.
Awesome. Which one do you prefer, saline or silicone implants?
Yeah, so I think the numbers are interesting in terms of the country. Most women in the United States pick silicone implant for these, reasons, right? Less rippling, there's no sloshing or anything like that. And the outside is still made of silicone. So whether it is saline or silicone on the inside, the outside is the same material. So the risk factors of what they're looking at have been about the same between the two. And especially since now all the implants are made with kind of gummy bear gel, which doesn't lose out or anything, it seems to be more safer, and then you get a better results.
Awesome. We got a question that says, do I need to get my breast implants replaced every 10 years?
That's, it's one of these questions of like myth or fact, right? And that really depends on when you got them done. If you got them done over like 25 years ago and there's something going on with them, then you want to get them replaced. If it has been within the last 20 years or so, you usually don't need to replace them anymore unless there's something you want to get changed. There's nothing that like expires in them. It's not there's no like the tires don't need to get changed out.
Awesome. Carol was asking, how do you know the right size implants for my body?
That's where you have to go to a board certified plastic surgeon to find out what the right size implants are. We base it off of a few different things. Most commonly, it's that chest width of like the distance of the footprint of the breast. And that's going to tell us how wide we can go. But again, not everybody wants to go as big in terms of the width. So there's different projections and profiles and widths of all these implants. And that's where you got to go to somebody that's done a lot of these. So that way they can pick the right implant and guide you in terms of what that's going to look like, what it's going to feel like. And most importantly, like make sure they're not too heavy.
Cool. Somebody was asking, how do I know if I need a lift or implants?
Yeah, so lift or implants, it really depends on nipple position, right? So it's just like we talked about, halfway between the shoulder and the elbow. If the nipple is quite a distance below that, then we're going to think about a lift. Versus implants can only move the nipple about 2 centimeters maximum. So if we know the distance we need to move, it kind of gives you an idea which one of those two options is best for you.
Awesome. Somebody asked, what if I'm scared of looking too done? Can I get this done and have it look natural?
100%, right? These implants come in all shapes and sizes. So again, if you don't really want anyone to notice, but you just want to feel fuller on your own, there are smaller implants that we can put in that are above the muscle or below the muscle, and no one's really going to notice that you had something big done. They'll look natural, and you'll still get the result that you want.
Tell us a little bit about above versus below the muscle. What's your preference?
Yeah, so that's a great question. I think the more that we can match the implant to be in the same place you have breast tissue, it makes the most sense, right? Not to interrupt any of your normal musculature, right? Like I don't want to really make you weaker. Mm-hmm. So most of the times, like my preference is to go above the muscle, just because I really like to make a nice tight pocket, keep the implant in the same place where the breast tissue is, and that way it all kind of glides together and it ages together. Versus if you go underneath the muscle, sometimes you can get that muscle to shrink down in size. You can see a little bridging between where the muscle was cut versus where the implant is. And so there's all these other things that can come with that. And so I think if you replace like with like in the same place, that's the best option.
Awesome. We got a question that says, how long do breast lift results last?
Oh, that's an awesome question, because I don't really have the answer. It really depends on what people do to maintain it, right? If they change in terms of their body weight and they go up 100 pounds and down 100 pounds, all that stuff's going to change. And so there's no like way to predictably say it's going to last like 5 years or 10 years. As long as we do the right things, it shouldn't last you for the rest of your life, unless you get pregnant or you have these body changes that are going to change the way that your structure changes in your breast.
Awesome. And if I was to get a breast reduction, how do you decide how much tissue to remove?
These are the wish picks, right? So we ask patients to bring in wish picks, and these wish picks really define how much tissue we're going to take off, because we're trying to match those in the operating room. I'm trying to make sure that we're right on point in terms of saying, hey, how much tissue we're gonna get out for each one of these areas to be able to do that. Thanks for tuning in.